rest and stay safe, okay?
The heart of Appalachia beats with the help of nurse practitioner Teresa Tyson.
How long did you work in the mines?
32 years.
32 years.
She runs the Health Wagon, the mobile medical clinic providing crucial health care to low-income and underserved people here in southwestern Virginia.
They don't have reliable transportation. They don't have the money for fuel to go to a clinic.
For 28 years, Nurse Teresa has navigated these rural roads of Appalachia to service those who otherwise may not get any medical care. What they need now, she says, is the vaccine. The Health Wagon services 2 health districts in the state. Those districts account for about 2% of Virginia's population. And this week, they received about 2,100 doses out of the approximately 120,000 vaccines allocated to the state. Now, that's just under 2%.
How about the COVID vaccine?
We are trying to get that.
Health Wagon, which has more than 5,600 active patients, has not gotten a single dose. Instead, they've gone to mostly local hospitals, local health departments, and long-term care facilities.
I'm just desperate to get the vaccine for my people.
We went to Dr. Danny Avula, the state's vaccine coordinator. He told CBS News there is not enough doses coming from the federal government to distribute to everyone who wants it.
A month or 2 months from now, as new vaccines come on the scene, we'll be able to start feeding all of these channels of providers and pharmacies who can get out the vaccine at large scale.
As of today, Virginia is deciding who gets vaccines based on population. But Nurse Teresa says that's not fair. Appalachia is more rural, but the need is enormous.
Vulnerable populations need to be a priority in receiving this vaccine. They have chronic health conditions. They actually live 10 years less than our counterparts on the eastern shore of Virginia.
And they're poorer here. Health Wagon says the poverty rate of the area it services is 54% higher than the rest of Virginia.
Is there something you can do to get vaccines here for them quick?
Absolutely. It's called more doses. And
he is Virginia's governor, Ralph Northam, who himself is a doctor.
Right now, David, we're getting about 120,000 doses a week. We need about 350,000.
Most of what I heard is Teresa's doing great work, but she just needs to be patient. What do you say?
Oh my gosh, I can't be patient. I have to be a voice for the people that do not have a voice here. How can you be patient in a pandemic when people are dying?
Here's the bottom line. Virginia needs more doses from the federal government, but so does every other state. In the meantime, what are they going to do to help Health Wagon? Full disclosure, when the governor heard CBS News was coming here, he asked to be a part of the story. And I thought he was going to come on and say, I'm sending doses there. He didn't. But Nurse Teresa remains optimistic. She's got a good relationship with the governor, and she thinks that now that he's on notice, so to speak, he's going to do something to help him. David Begnaud, CBS News, here in Appalachia, in the westernmost part of Virginia.